Nipple pain can feel isolating, but you're far from alone. Millions experience it, especially new mothers. It's a challenge that can catch you off guard, even if you've prepared for every other aspect of parenthood. The truth is, nipple pain is a common part of the journey for many, and it's nothing to be ashamed of. Whether it's a dull ache, a sharp sting, or a persistent soreness, this pain is common and almost always temporary. It can show up unexpectedly, sometimes right after birth or even weeks later, and it can make everyday moments feel overwhelming. It's not a sign of failure, but a signal your body needs a little extra care and attention. Your body is adjusting, and sometimes it needs time and support to heal. Pain can turn bonding moments into something you dread, but relief is possible. You deserve to enjoy these precious times with your baby, free from discomfort and worry. With the right information and support, you can heal and regain comfort. Reaching out to others, whether friends, family, or professionals, can make a world of difference. We'll explore why nipple pain happens and what you can do about it, step by step. Understanding the causes is the first step toward finding lasting relief. The goal isn't just to manage pain, but to resolve the cause so you can move forward confidently. You'll learn how to listen to your body and respond with gentle, effective care. Be patient and kind to yourself. Seeking help is a powerful first step. Healing takes time, and every small step you take matters. This guide will offer clear, practical advice you can use right away. From simple self-care routines to knowing when to ask for help, you'll have tools at your fingertips. We'll break down causes, gentle remedies, and prevention. You'll discover tips for soothing pain, protecting your skin, and making feeding more comfortable. By the end, you'll feel empowered and equipped to say goodbye to nipple pain. You'll know how to advocate for your own comfort and well-being. Let's begin this journey toward comfort and healing together. Remember, you're not alone. Support and solutions are within reach. You deserve to feel well. Let's take the first step by understanding what's happening to your body and move forward with hope and confidence. Cracked nipples, also known as nipple fissures, are small breaks, cuts, or splits in the skin of your nipple or the surrounding areola. These tiny wounds can develop for a variety of reasons, but they all have one thing in common. They make breastfeeding uncomfortable and sometimes even painful. Imagine the feeling of chapped lips, dry, sore, and sometimes cracked open. Now picture that same sensation, but in a much more sensitive and delicate area of your body. That's what cracked nipples can feel like for many breastfeeding parents. These wounds can range from nearly invisible hairline cracks to more obvious splits or even small areas that bleed. Sometimes you might only notice a stinging or burning sensation before you see any visible signs. For some, cracked nipples mean mild dryness and tenderness. For others, it's a sharp shooting pain, especially during feeding sessions or when clothing brushes against the area. Even the softest fabric can feel rough when your skin is this sensitive. The skin may appear red, raw, or flaky, and as your body tries to heal, you might notice a small scab or crust forming over the crack. This is a normal part of the healing process, but it can make the area feel even more tender. Early recognition is key. Catching cracks before they deepen or become infected can make a big difference. Addressing them quickly helps prevent worsening and speeds up the healing process, so you can get back to comfortable feeding sooner. The skin on your nipple is incredibly delicate and not naturally designed for the constant friction, moisture, and suction that come with breastfeeding. It takes time for your body to adjust, and sometimes the skin simply needs extra support. Cracks are a sign that your skin is under stress, not a sign of weakness or failure. They're a common experience and nothing to be ashamed of. Think of them as surface wounds that need gentle, consistent care. Moisturizing ointments, air exposure, and proper latch techniques can all help the skin recover. The goal is to protect the skin, minimize further irritation, and give your body the chance to repair itself naturally. Rest and self-care are just as important as any topical treatment. Preventing further damage is just as important as treating the current wound. Using soft nursing pads, adjusting your bra, and making small changes can make a big difference. By understanding what causes cracked nipples and supporting your body's healing, you lay the foundation for lasting relief and a more comfortable breastfeeding journey. The most common cause of sore, cracked nipples is breastfeeding, specifically a shallow latch. If a baby latches only on the nipple tip, repeated friction and pressure can quickly cause pain and cracks. Dryness is another factor. Harsh soaps, detergents, or dry weather can strip natural oils, making skin prone to cracking. Avoid washing nipples with soap, plain water is enough. Friction from tight or synthetic bras or rough seams can also irritate the skin. Some nursing pads trap moisture, softening skin and increasing vulnerability. Choose soft, breathable fabrics and change pads when damp. Infections can complicate healing. Bacteria or yeast can enter through cracks. Bacterial infections cause sharp pain and discharge. Yeast, thrush, causes burning and shiny, flaky skin. Sometimes infection is the reason healing stalls. Recognizing infection signs is crucial, as they need specific treatment. When you need relief from nipple pain or tenderness, start with a warm compress. Gently apply a soft, warm washcloth to your nipple before each feeding session. The warmth helps to increase blood flow, relax the milk ducts, and can make latching more comfortable for both you and your baby. Take a few deep breaths and allow yourself a moment to relax as the warmth soothes the area. After feeding, switch to a cool compress to help reduce swelling and numb any lingering pain. A cool gel pack or even a bag of frozen peas wrapped in a soft cloth can work wonders. This simple step can help minimize inflammation and provide instant relief, especially if you're experiencing soreness or engorgement. Your own breast milk is a natural healer. After nursing, gently express a few drops and let them air dry on your nipple. Breast milk contains antibodies and healing properties that can soothe irritation and promote faster recovery. Allowing breast milk to dry naturally creates a protective antibacterial barrier over the skin, helping to guard against infection and further irritation. Once your skin is dry, use a purified lanolin cream or a natural nipple balm to keep the area hydrated and prevent further cracking. These creams form a gentle shield, locking in moisture and supporting the skin's natural healing process. When choosing a product, look for creams with minimal natural ingredients. Avoid anything with added fragrances or harsh chemicals, as these can irritate sensitive skin. Most nipple creams are safe for babies and don't need to be washed off before the next feeding, making them convenient for frequent use throughout the day. Let your nipples air dry as much as possible. Trapped moisture can weaken the skin and slow down healing. Whenever you can, allow your skin to breathe freely. After feeding or showering, expose your nipples to air for a few minutes. Even a short break from clothing can make a big difference in your comfort and recovery. If you need to wear a bra, consider using breast shells. These handy devices prevent friction, allow airflow, and protect sensitive skin from rubbing against fabric. By combining these simple steps, you create an ideal environment for your body to heal. Remember, self-care is essential during this time. Consistency is key for relief and recovery. Make these remedies part of your daily routine, and you'll likely notice steady improvement and greater comfort with each passing day. Prevention is better than treatment. Maintain healthy, resilient skin with gentle care. Avoid harsh soaps or scrubs. A warm water rinse is enough to keep nipples clean. Choose bras and tops made from soft, breathable fabrics like cotton or bamboo. Ensure your bra fits well. Too tight causes friction, too loose allows rubbing. If you use nursing pads, opt for reusable, absorbent ones and change them when damp. Protect nipples during exercise with a balm or anti-chafing stick, and wear a well-fitted sports bra. For extra protection, use bandages or nipple guards during high-friction activities. A little preparation goes a long way in preventing pain. Healthy habits keep your nipples comfortable and strong. For breastfeeding mothers, mastering the latch is crucial for comfort and healing. Aim for an asymmetric latch. Baby's chin pressed into your breast, lips flanged outward, and a deep mouthful of areola. Bring your baby to your breast, not the other way around, and wait for a wide-open mouth before latching. Pain during feeding means the latch may be too shallow. Break suction gently and try again. It's better to relatch than endure pain that causes damage. If you struggle, seek help from a lactation consultant or support group. They can check for issues like tongue tie and offer hands-on guidance. Sometimes a small adjustment in positioning makes all the difference. Investing in a good latch pays off in long-term comfort and breastfeeding success. Don't hesitate to ask for help. Support is available. A comfortable latch is the foundation for healing and prevention. Nipple pain isn't just from breastfeeding. Skin conditions like eczema or psoriasis can cause dryness and cracking. If you have a history of these, consult a doctor for appropriate creams or moisturizers. Hormonal changes during your cycle or pregnancy can make nipples more sensitive. Be extra gentle with care during these times. Athletes often experience runner's nipple from friction. Apply a protective balm and wear moisture-wicking, well-fitted gear. For severe cases, use bandages or nipple guards during exercise. Rarely persistent nipple changes may signal a serious issue like Paget's disease of the breast. Symptoms can mimic eczema, itching, redness, flaking, or a flattened nipple. If symptoms don't improve with home care or are only on one side, see a doctor. Early evaluation is essential for peace of mind and proper treatment. Most causes are benign, but vigilance is key. Home remedies work for most, but know when to seek medical advice. If pain is severe or not improving after a few days, consult your doctor or lactation consultant. Signs of infection, pus, yellow discharge, bright red or shiny nipples, deep burning pain, or intense itching require medical treatment. Fever or red streaks on the breast may indicate mastitis, a serious infection needing prompt antibiotics. Any unusual or persistent nipple changes, lumps, sudden inversion, or skin dimpling should be checked by a doctor. If a crack won't heal after weeks of care, get it evaluated. Early intervention prevents complications and speeds recovery. Don't hesitate to reach out. Your health and comfort matter. Healing from cracked nipples takes patience and self-kindness. Your body is doing amazing work. Pain is just a hurdle, not a measure of your worth. Remember the basics. Correct the latch, use gentle wound care, and prioritize prevention. Warm compresses, breast milk, and lanolin cream support healing. Air dry nipples, wear soft clothing, and be gentle with cleansing. Consistency creates the best conditions for recovery. Don't hesitate to seek help. Lactation consultants, doctors, and support groups are there for you. Asking for help is a sign of strength and commitment to your well-being. Every step you take toward healing is a victory. Trust your body's ability to recover and your own resilience. The discomfort is temporary. You'll soon look back on this as a challenge you overcame. Be proud of your efforts and progress. You're doing a wonderful job. Healing is within your reach.